Okay, ended the first session with this screen and we had labeled closed cavities and we were looking at the pericardial and the pleural cavities of the thoracic cavity. We can see the abdominal pelvic and cavities as well, the abdominal and the pelvic. One thing that you need to know about closed cavities is that they're all lined with serous membranes. Serous membranes. There are two types of serous membranes found in these closed cavities. The serous membrane that always lines the closed cavity is called the parietal serous membrane. And then you have another membrane that's called the visceral serous membrane, and it's going to cover the organ. So if you're starting superficial and you're going deep, the parietal is lining the cavity and the visceral is covering the organ. And in between the parietal and the visceral, you're going to have some serous fluid. The purpose of that is when the organ that's wrapped in that visceral serous membrane contracts or moves and rubs on that parietal membrane that lines the cavity, there's reduced friction or lubrication provided by that serous fluid. So if we were looking at the pleural cavity, we would have pleural fluid between the parietal and visceral pleura membranes. If we were looking at the heart, they would be called pericardial membranes. If we were looking at the abdominal pelvic cavity, they would be called peritoneum. Visceral covering the abdominal organs and parietal lining the cavity, always with fluid in between them. So on your sheet where it says C, closed cavities are lined with serous membranes, parietal lines the cavity, visceral covers the organ. One good way to remember that is that visceral has a C in the middle of it. Visceral covers. Cover starts with a C. Now let's move on to open cavities. We have several open cavities and we'll just list a few of them. You have open cavities and they're always going to be lined with mucous membranes. These are membranes that secrete mucus, which mucus is sticky, and anything entering from the outside, foreign antigens that aren't supposed to be entering, are going to be captured in this mucous membrane as part of the immune response and help to protect us in these cavities that open right to the outside. So let's look at a few of these open cavities that are lined with mucous membranes. The eye is housed in the orbital cavities. The nasal cavity, of course, is the nose. It's lined with mucous membrane. The mouth cavity is known as the oral cavity, again, mucous membranes. And the ear, inside the middle ear, mucous membranes. These are just 4 open cavities associated with the skull. We also have the opening to the urinary system, the urethra, that would be lined with mucous membranes. The opening to the digestive system on the distal end would be the anal cavity or the anus. Again, mucous membranes. If you're looking at a female, female has another opening in her genitalia, and that's the opening to the vagina. Again, mucous membranes. Mucous membranes line open cavities. There is one other type of cavity that we find in the body, and that's a cavity that's found between bones, and that's known as a joint cavity or a synovial cavity. This cavity is filled with synovial fluid. This type of membrane that lines the synovial cavity, synovial membrane, is different from all the other membranes we've looked at because it only has a connective tissue layer. Most membranes have the epithelial layer and the connective tissue. This is only connective tissue. This very slick, cartilaginous synovial membrane lines the cavity so that when the bones come together, it's slick and it reduces friction and is lubricated for smooth movements. Now, let's move on to the abdominal pelvic regions. We have such a big cavity below the diaphragm. It's called the abdominal pelvic region, and sometimes it's hard to compare body structures because that cavity is so large. So there's 2 different ways to divide up this cavity. So we could compare like the liver to the cecum. The liver is in the upper part, the cecum is in the lower part, but is it on the right or the left? So one way we do that is we divide this cavity just into 4 equal parts. This way is probably the easiest. It's not as precise as the other way, but it's the easiest. We label these 4 areas: the upper right quadrant, the upper left quadrant, the lower right quadrant, and the lower left quadrant. So on your worksheet where it says 7 abdominal pelvic regions, if you'll take a blue pencil and write upper right quadrant in the correct box, red pencil upper left quadrant, yellow pencil lower left quadrant, green pencil lower right quadrant. So if I'm looking at my appendix, it's going to definitely be in the lower right quadrant, where my gallbladder is definitely in the upper right quadrant. An organ like my stomach is mostly in the upper left quadrant. It goes a little bit into the upper right. So if someone was having pain in their abdominal pelvic region, they could show the nurse, and then the nurse could very correctly tell the physician which part of the abdominal pelvic region the pain is coming from. A more precise way to divide this abdominal pelvic region is into 9 almost equal areas. We're going to learn these 9 areas in a systematic way instead of just filling it in. I always like to start in the middle box. This is a tic-tac-toe, and you can fill this in on your worksheet as we go. Everybody knows where the belly button is. Well, the belly button is a leftover remnant of the umbilical cord, so this middle area is umbilical. That one's easy. Now, if I went into the emergency room and I had a stomach ache, I might be holding my umbilical region. So sometimes I like to think, well, that's my stomach to the layperson. Another word for stomach is gastric. So above the umbilical and below the umbilical are above and below a stomach region. And so we call the above the epigastric, because that prefix epi means on top of, and below it the hypogastric, because hypo means low or below. Epigastric, hypogastric. Now let's move to the other 2 middle areas, to the right and to the left. You are going to be learning anatomical words and learning a whole new language. One that you're going to learn is the word lumbar. Lumbar is the small of the back. I always remember lumbar because I slumbar on my lumbar if I sleep on my back. So it starts on the back and then it comes around to the sides right above your hip. So when we label those 2 areas, we have the right and left lumbar region. Now let me back down since my screen went ahead and labeled right and left iliac. If you place your hands on your hip bones, your top of your hip bone is called your iliac crest. So that area that would be underneath your hip bone is the right and left iliac region. We only have 2 more regions left. And when I first started teaching this and trying to remember what those 2 regions were, those were the hardest for me. And so I started thinking, well, my patient is hurting everywhere. They must be a hypochondriac. And so those areas are the right and left hypochondriac region. Really, in this anatomical region, hypochondriac means below the cartilage. And if you think about, it's below the rib cage where the cartilage is connecting the rib cage together into the sternum. This area is below the cartilage on the right and left side. So I hope my little explanation will help you learn these 9 anatomical regions instead of just memorizing them. On the back of your worksheet, you'll notice these 2 men. These are pointing to all the anatomical areas that you are responsible for. You are responsible for knowing the anatomical if given the common term, or if I give you the common term, you can say the anatomical. For example, the arrow pointing to the mouth is the common term, but oral is the new term. The neck region, that is the cervical. In between, in the middle of the chest is the sternal area. We already did the belly button. It's umbilical. The upper thigh, since the bone that runs through that thigh is femoral or femoral, I've heard. The front of the knee is patella. I always remember that because if you're sitting down and somebody comes up to talk to you, they might pat you on the front of the knee, so patella. Whereas the back of the knee, if I squat down, you'll probably hear my knee pop. So the back of the knee is popliteal or popliteal. The calf muscle is the gastrocnemius muscle, but the back of the leg The back of the lower leg or the calf is sural, whereas the front of the lower leg is cruel. I always think it's cruel and unusual punishment if I have to do leg lifts. So that leads me to cruel on the front of the lower leg and sural on the back. Your heel has a calcaneus bone in it, so calcaneal is the heel. If you plant your foot firmly on the ground, that's plantar. Your hip bones are also called your coxal bones. I think about us standing and cocking our hip to one side. Your chin is mental. If you think about the great thinker statue, he had his chin resting on his hand and he was in great mental or thinking. He was thinking or in deep mental thoughts. So mental is chin. Think of the great thinker. The forehead would be frontal. The back of the head would be occipital. The ears would be otic or auditory. That's just to name a few. I'm going to let you come up with your own ways of remembering them. Through the years, I know that students who learn these, not memorize them, come up with fun ways of learning them. Like I said, plantar, you plant your foot firmly on the ground, or you pedal a bike with your whole foot. Pedal is foot. If you associate these anatomical terms with things you already know, they'll be easier to learn. What I can associate with and what you can associate with are two different things. So it's really better for you to come up with your own little methods of learning these. Probably one of the best ways to learn these anatomical terms is with flashcards. Get yourself some index cards, write the common name on the front, the anatomical name on the back, and practice. First looking at the common and saying the anatomical, and looking at the anatomical and saying the common. You are going to have to know these terms throughout your entire anatomy experience and then on into the healthcare professions that you're going into. So you might as well learn this language now. I hope that everything I've told you about Lab 1 terminology will help you and help you complete that worksheet so that now you can submit it for a grade and study it later when you take the first lab practical. If you have any questions, please message me on Canvas. Thank you.